Hi, everybody. My name is Dr. Tigidi, and I'm one of the cardiology attendings here at Pat and Jim Calhoun Cardiology Center at UConn Health. I want to discuss the importance of women's cardiovascular health and what we can do to recognize and improve outcomes in women. And why do I say this? Let me start there. So, 1 in 3 women die of cardiovascular disease and stroke here. And this is not breast cancer that's causing death. This is not other types of malignancies that cause it, but 1 in 3 women die, and it's the most common cause of death in women. So recognizing our risk factors upfront at a young age, recognizing the symptoms, seeking emergency care and medical advice when appropriate, will improve cardiovascular disease. It's been proven in multiple studies that women under-recognize their own symptoms, are undertreated in by medical professions, and they also don't get appropriate treatment, and hence overall the cardiovascular mortality is high. We have to be our heart hero. It's important for every individual woman to recognize what her risk factors are and change her lifestyle appropriately. Say when we are young, we go through pregnancies. There is hypertension in pregnancy, preeclampsia, there's gestational diabetes. And then as we get older, high blood pressure is very common. Women tend to sometimes get diabetes at an earlier age and hence longer duration of diabetes, family history. And there's autoimmune diseases, which are more common. So we have to recognize our own risk factors and change our lifestyle early on to prevent heart disease. And our symptoms can be different. Women are different, our symptoms can be different. Typically, heart attacks start as just pressure or pain. That can radiate to the neck, to the jaw, to the left arm. Sometimes associated shortness of breath, but women can have, say, nausea and heartburn. Say they'll have symptoms of little sweating, they have some nausea, vomiting, and gastritis kind of symptoms. But again, listen to your body. If these symptoms are coming on suddenly, you don't feel good, patients are dizzy, should seek medical care. And why are we so sort of emphasizing on early recognition of these? So as I mentioned earlier, having high blood pressure, gestational diabetes, and pregnancy related complications predict overall risk of heart disease. It predicts diabetes in future, predicts hypertension, risk of stroke, and heart disease is more in women. And if we recognize and teach our patients, teach ourselves to recognize these things and change our lifestyle and seek medical care, we will change our outcomes. The traditional risk factors are high blood pressure, cholesterol, diabetes, physical inactivity, poor diet, and family history contributes. Cigarette smoking is a big risk factor and patients should abstain from it. But in addition to these, there are other things that women go through and that increases our risk of heart disease. For example, now we have polycystic ovarian disease. It starts in young women. Women tend to have glucose intolerance, dyslipidemia. This increases their heart disease risk. Autoimmune diseases like lupus and rheumatoid arthritis, much more common in women, and chronic inflammation will lead to increased heart disease. Breast cancer survivors, definitely treatment has improved, but we are seeing so many women with complications from there. Patients can have heart failure from there. Patients have increased heart disease from there. So these risk factors are more among women and have to be recognized. And on top of this, if we add, say, anxiety and depression, more common in women, together increases inflammation and hence higher risk of heart disease. Blood pressure should be well controlled and well treated. And what can we as individuals do? If women have had preeclampsia during pregnancy, they should check their blood pressure within 3 months. Annual physical should be performed. Drinking more than 1 drink of alcohol a day increases blood pressure. Obesity increases blood pressure. So weight loss is important. Staying physically active is important. And all these things will reduce blood pressure. And if there is still hypertension, that should be treated. Statins are good medications which will improve cholesterol, and overall in primary prevention and secondary prevention guidelines by ACC/AHA recommend statins when appropriate. Women tend to have poorly controlled diabetes. poorly controlled cholesterol, poorly controlled high blood pressure. And sometimes when we give medications, women tend to have more side effects. Say women with high cholesterol of LDL more than 190, women between 40 years and 79 years of age should be screened for cholesterol and treated. And sometimes women have more side effects to statins. In that event, different statins should be tried, different doses should be tried. There are other medications which can be useful, but this should be a discussion between the individual and the physician to come up with the right plan for the patient. Diet extremely important. I cannot emphasize how important this is, and this has to begin early on in as a change in lifestyle. Half of our every meal should be based on vegetables and plants, a quarter with whole grains, with wild rice, brown rice, like rolled oats. These will improve your dietary these will improve your dietary cholesterol intake. A quarter of your meal should be from protein. Again, plant-based protein is recommended. This slide, published by ACC/AHA, is a comprehensive way for you to look at your cardiovascular health. Controlling high blood pressure, as I suggested, physical activity. If people can do lap swimming or play singles tennis or run, so this is high endurance activity, or say go for a brisk walk, which is moderate intensity. This is important. Aspirin use when indicated and discussed with the provider. Type 2 diabetes should be controlled well. Diet, as I emphasized earlier, plant-based diet with more vegetables, beans, and legumes is important. Smoking cessation is one risk factor which is in our hands, and this will improve our cardiovascular outcomes. Cholesterol control, diet and lifestyle modification first, and when appropriate and indicated, medications as a collegial discussion with your provider. These things together and early recognition of symptoms in women, in young women, when patients recognize their risk factors early on in their 30s and improve their lifestyle, take control of their life, this will improve the cardiovascular risk factors and their outcomes. And this is essential. Thank you for this opportunity. And women's heart health is important. Thank you.